All right, and welcome back to the Monday Injury Report. I'm Nick, and I'm joined, as always, by Dr. Mark Casimiro. What's going on, Mark?
What's up, Nick? It's Thanksgiving week. I'm ready for those mashed potatoes and that turkey. Heck yeah. That's how I eat everything.
Not to mention we have football all day long, which
Right.
that helps too. And that's what that's what we're going to talk about today. We'll give everybody a couple minutes to log on now that we're live. We are live on Facebook, Twitter, and YouTube. So if you are watching on any of those, give us a wave, tell us, say hi, let us know that you're watching. And if you have any questions, make sure to write them in the comments, and we'll address those today. I know I already have a few things to ask you, Mark. So this one isn't fantasy related unless you're in like a dynasty league or in a keeper league. But let's jump in with quarterback Joe Burrow. He had some bad news today. I mean, it looked bad if you watched it yesterday, but when you heard today, it was both his ACL and his MCL. So we both know that he's done for the season. But with an ACL, I feel like we're pretty accustomed now to knowing that, they'll be good to go next year at some point. When you hear ACL and MCL and then also the words worst case scenario, what does that mean for his recovery, and when can we expect him back? Is this a chance that he misses sometime next year, or maybe even all of next year recovering from this now?
That's a great question, Nick. I think it comes down to one big thing. So an injury that we talk about a lot in athletic training and physical therapy world is called the unhappy triad, which is the ACL, the MCL, and the medial meniscus. So Willis McGahee did that when he got injured. I believe Carson Palmer. Wow, I'm really showing my age with these names today, Nick, huh? So Carson Palmer did that as well. So there's some the MCL and the medial meniscus, which is like that disc that separates the tibia, the shin bone, from the femur where your knee is. So that meniscus is there to help like protect the bones and make sure there's a little bit of cushioning in there, make sure you don't go bone on bone. So the MCL ligament, which is the ligament on the inside of the knee, if you just damage that, you usually don't need to have surgery. Those things usually heal up on their own. You can get an MCL injury that can pull on some of the fibers of the medial meniscus, which can make it more difficult recovery. The biggest thing with meniscus injury is sometimes they repair them. Sometimes for Joe Schmoes like you and I, Nick, well, Joe Schmo like me, I'm not going to call you a Joe Schmo, Nick. You're better.
It's fine.
So for most of us mere mortals, they will usually do a meniscectomy where they, cut the tear out and just make sure that everything's safe, that the patient's not going to have any clicking or buckling in their knee, and then they go along with rehab. They can do a meniscus repair, and on athletes, and especially an athlete like Joe Burrow, who's a little bit younger, who they have a lot of investment into the future, they can do a meniscus repair. But when you talk about repairing the meniscus, that's a weight-bearing structure and a load-bearing structure in the knee. And so you have to be very careful when you start giving a lot of load into that structure during the rehab. So that plays an effect on being able to, with ACLs, usually like day one, we can get them up and standing and start strengthening right away and start working on the quad and working on range of motion, stuff like that. If they have a meniscus injury, which would my experience would be the worst case scenario, that would take a little bit more time to recover from and would delay some of the other things that they're looking for. So in that situation, yeah, you could see him maybe having to miss. It's only November. If we fast forward 8-9 months, that brings us to October, September, October, around that time of the year. So that looks like maybe he would have to miss some time. If he has the meniscus involved with the ACL and the MCL, then you can say, okay, it's going to take even a little bit more time for him to go through the rehabilitation phases. And then maybe he has some issues as he starts going into like the running and stuff like that because of that meniscus injury. The MCL is not a really big deal from an athletic training standpoint or a physical therapy standpoint. That's not a big deal. That's going to be long healed. When you start going through the ACL rehabilitation process. So that's not a big deal. But if there's a meniscus involved in there that they're not telling everyone, that could be a little bit of an issue and put a little wrinkle into him being able to be ready for next September.
Let me ask you just a real quick question. Does it matter whether it's his, being a right-handed quarterback, whether it's his front leg versus his back leg, where he might be, pushing off more when he's trying to, get the ball downfield?
It's a great question. I think the only thing that makes a difference is how comfortable he is. So if you remember, I think with Tom Brady, it was his left leg that he tore because he was stepping into a throw and then Pollard came in right there.
Sure.
So I think if he's right-handed and if it's left leg, being able to step through that throw and generate some torque on it. A lot of times those quarterbacks are very nervous to step into their throws because they're nervous about those big bodies down by their feet. And they're worried about the same injury happening again. Gotcha. So I think that's the only thing that makes that would would be the psychological factor of that, like knowing when bodies are on their feet and making sure I feel comfortable stepping into my throws. And if you've watched some Patriot games, you can understand the technique of throwing. Being able to step into those throws can make a difference between being able to throw a 20-yard out or a 30-yard out versus like a 5-yard out. So that can definitely play a role.
Definitely makes sense. The next guy we're going to talk about, somebody, people might have some fantasy shares of him, but he's probably more just a local guy in most people's hearts. They haven't released his diagnosis yet, but Rex Burkhead, running back for the Patriots yesterday, ugly. It looked like a helmet to the knee. His knee looked like it, didn't bend the right way. He went down, didn't get back up. What is if you had to guess what they're going to release for his diagnosis, what do you think it's going to be?
So I think he might be along the same lines as Joe Burrow. I think you might hear an ACL, MCL, maybe even a meniscus injury as well. Watching that play, not to date myself again and show my age, but it reminded me of when Willis McGahee got hurt in that national championship game when he played for the Hurricanes. Same kind of hit. Same kind of force. You almost saw the knee, twist and then kind of buckle when the ligament looked like it snapped. And obviously he was in a lot of pain. So I would expect the same thing from him. I think with Burkhead, you're looking at a guy who's a little bit older and he plays running back, which is a little bit more strain on his knee. There's a little bit more force on his knee for cutting and changing direction and stuff like that. And he also has a little bit more wear and tear in his body with the injuries that this guy has had. So, hopefully he can make a comeback next year, but I don't know how effective he's going to be coming back next year. And I would say if we fast forward a year, that's usually 10 to 12 months for healing for these ACL injuries in the NFL. That brings us to November. It's going to take these running backs. It takes them, the running backs, the defensive backs, and the wide receivers a little bit more time to get comfortable because there is so much stopping and starting and cutting and changing direction on their knees. So it would take probably 3 or 4 weeks before he got a little bit more comfortable. So now you're looking at pretty much an entire season. So hopefully he's able to come back and contribute to some team, if not the Patriots. But it's going to be definitely a long road for him, and I wouldn't expect much out of him next year.
Yeah, it's unfortunate. He's been really good for the Pats. I mean, he's, both catching the ball and running the ball. I mean, I feel like if he's like a security blanket for Cam or whoever's back there, and he's just reliable. He's probably not going to bust out a huge play, but, he's just somebody that you can always look to and he's ready for whatever. So it's going to be unfortunate if he has to go out. So another, we're gonna talk about football some more, but let's take a little side note. So you have Clay Thompson. He's recovering from ACL surgery, and he's in the gym working out. When I hear a gym, I'm assuming he's shooting a basketball when I hear the gym, but I guess I could be wrong. And then he goes down, can't put any weight on his leg, and it comes back that now he has torn his Achilles. So that's season ending. He's going to miss the upcoming season. He missed this past season. When he does come back, which I'm hoping will be, the following season after that, what type of player is he going to be? He's going to be on 2 bum wheels now. One coming back. Is this going to be physically possible to overcome, or is it going to be more of a mental challenge for him to be able to do that?
My answer to that question is yes. It's going to be both. It's going to be both, obviously, Nick. I mean, so the ACL, research shows that we can get athletes back to having the same kind of power output that they had before the injury. The surgical techniques are way better now than they were even like 10 years ago. These athletes in the NBA obviously have access to a lot of great healthcare professionals. So the ACL, like, you can come back from that without a problem. Without a big problem, right? There is some time that it takes to get a little bit more accustomed to it again. Once you start playing again, you get comfortable on it again. We saw someone in Boston have to deal with that. Gordon Hayward, just to me, never looked like he mentally got over that injury that he had that first game with the Celtics. So certainly there's a mental component to it. My concern is the physical concern. With Achilles injuries, generally speaking, we're getting people back to about 80% of whatever strength they had pre-injury. So my question is, like, does that take an elite athlete and make him now a little bit closer to the rest of the pack? And now maybe things that he was able to do before the injury that put him, ahead of a lot of other athletes in the NBA, does that bring him more closer to the pack so he's not, as dynamic and not as, maybe not as much of an all-star anymore? I don't know. I mean, I think we saw the same exact thing with Boogie Cousins. Boogie Cousins had the quad rupture. I don't think he had an ACL tear. I think he ruptured his quad. He ruptured his quad. He had a quad rupture, and then he was rehabbing, and then he tore his Achilles tendon. So obviously, there's a huge difference between Boogie Cousins' size and body frame and body type as opposed to Klay Thompson. Klay Thompson's a little bit smaller, a little bit longer. That can have an effect that could help Klay Thompson. He doesn't have as much weight. But still definitely very, very difficult. And this is why when people come into PT and they say, hey, I had surgery on my hip. Why are you doing things for the other side? Or why are we doing things for the feet? And it's like everything is connected. If you pay too much attention to just the knee, these kind of things can end up happening where you're not doing everything else to make sure all the other body parts and everything else feels good as you are returning from injury. And I got to say, as an athletic trainer, there's nothing that hurts me more than when an athlete works really hard to rehab his ACL or his shoulder or whatever, and then ends up hurting elbow, knee, or something else. And that's kind of very difficult mentally, obviously. You worked all this year. You're trying to get back into the season. The season's going to start in a month, and now you're going to have to sit out a whole another year. So it kind of is really challenging, really difficult. So everyone out there who's doing PT, listen to your PT. Make sure you're working your whole body, not just one joint.
Yeah, that's some good advice. I mean, I also wonder, where it's going to affect him more on the offensive end or the defensive end of the court. He's a spot up shooter, but he's also a good defender. And, I know with the athleticism in the NBA, being able to keep up with some of these, top level athletes, it's going to be tough. So we were wishing him well. And like you said, that's a worst case scenario, rehabbing from one season ending injury and getting another one. Yeah, it's unfortunate and you hate to see it. All right, back to the NFL. I'm gonna give you a redo of someone we spoke about last week. I think about an hour after we went live, the news came out about Drew Brees. We thought, maybe he was gonna have to put a flak jacket on and he might actually come out and play this past weekend. And then the show ended, and we found out that he had multiple rib fractures. Now they're saying it's up to 11 fractures, and he had a collapsed lung. So Mark, how long do you think Drew Brees is going to be out for? So we know it's going to be at least 3 weeks because they put him on IR.
So let me start with this. Most of us have 12 pairs of ribs, right? So we have 12 pairs of ribs. So 24 ribs total, 12 on one side, 12 on the other side. Most of us. Some people are a little bit funky or a little bit weird or unique, we'll say. So if he has 11 rib fractures, he's pretty much half of his rib cage is fractured. We don't know the extent of those fractures. Sometimes you can get, ribs can be fractured in multiple places as well, which really sucks. We call that a flail chest. I think it's 2 or more ribs in 3 or more places. It's called a flail chest. So he's pretty close to that if he's got 11 fractures. I am going to go on a limb here, Nick, and say that it's November 23rd. I do not see him being able to participate until the playoffs again. I just don't see it. I mean, he's going to be, I know they're saying he's going to miss 2 or 3 weeks, but it's going to be tough for him to breathe for the next 2 or 3 weeks. We're not even talking about him taking a hit. What if he gets hit on the blind side, from a DB that he doesn't see, and he's in that throwing motion? It's going to be dangerous, man. It's going to be dangerous. He can get some lung injuries, stuff like that. So that's very serious. I don't see how he's going to be able to participate in any more games until maybe the postseason. And I think even that would be tough. So if you have him in your fantasy leagues and maybe stash him, we'll get some more information on him. But definitely want to maybe see if you can get another option at your starting quarterback. Hopefully you have a deep bench, because I don't think he's going to be available for the foreseeable future.
I know, and it's crazy. The Saints currently have the 1 seed right now. It's like, how are they going to be able to carry that without him till he can come back? They didn't start Jameis this past week. They start Taysom Hill. That works out for them. So, it's going to be wild to see. So what I'm going to do now is hit you with a little bit of a lightning round, because we have a bunch of guys that are hurt. But it's basically going to be stash them, like put them in your IR, put them on your bench if you have room for them, or these guys aren't going to help you this year unless maybe it's going to be late in the playoffs, but they're not going to be back anytime soon. So somebody we talked about last week. We got Christian McCaffrey, shoulder injury. It looks like he's not going to play again next week. What do we do with Christian McCaffrey, the consensus number 1 overall pick in fantasy this past season?
Stash him.
Okay. All right. I'm gonna hit you with 2 more. Both these guys are the number 1 running back for their teams. You get David Montgomery and DeAndre Swift, both playing fairly well. DeAndre Swift really breaking out. Boom! They both get concussions. They missed this past week. As an athletic trainer, you've seen concussions. Running back, we know, is a high contact rate position. But do you think these guys will be back sooner rather than later?
Let's see. What's week is it? That's the thing too. It's so late in the season now. I'll say, I want to redo this again next week, but stash him for now. Stash him for now until next week.
Stash him for now. Yeah, we can revisit these. Revisit these. And then another guy, he just got put on IR, Joe Mixon. He's great when he's out there. He's missed a lot of time this year. He's going to miss at least 3 weeks. This past week was week 11. So we're talking he's not going to be back until probably week 1 or 2 of the playoffs. Is he someone you stash, or, Joe Burrow just went down. Does he come back at all?
I think no. I think you can get rid of him. I would not stash Joe Mixon. I think he's done for the season. I don't think he's going to come back. And even if he does come back, I don't think he's going to be very effective. So, yeah, get rid of him. I'm out. I'm out on Joe Mixon.
He's taking up valuable bench space with all the – you see how many COVID outbreaks some of these teams are having now. The Ravens, sounds like it's running through their team pretty bad. So every bench space, every IR spot is valuable. So listen, everybody out there, remember, if you have any questions about your players, join us live. We started late today. We had a scheduling conflict this morning, so we had to do it a little bit later in the day. But we're going to try to make sure to schedule it and see what works best for everyone, so you know when we're going to be on. You can always leave comments in the previous week's injury report with any questions that you have, or you can join us live and ask us questions live, and we will answer them. And everyone, remember, this month we are dressing down for Movember. I got my little mustache coming in for men's health, mental health, depression, suicide, prostate cancer, all of those different men's health issues. That's what we're dressing down for. That's what we're doing our Care to Wear initiative on Fridays. Once again, if you have anybody you want to see us talk about, make sure you have to put it down in the comments so we know who you want to hear about. We got only 2 more weeks of the fantasy regular season, and then it's on to the playoffs. So now's the time to get that final push, get that final couple wins to hopefully sneak in if you haven't already locked up a playoff spot. Mark, as always, thank you for joining us.
Thanks so much, Nick. See you next week, my man.
See you next week, everybody. Have a happy, healthy, safe week. Don't eat too much on Thanksgiving. Enjoy, but make sure you get out there and move this weekend too. Work off some of those calories. Enjoy football. Enjoy your small family gatherings, or your just your immediate family gatherings, and have a happy, healthy, safe, fun Thanksgiving. Peace.
Gobble, gobble.